those. Some of you know, most of you probably know that this is a series of summits, and this is actually the third and fourth regional travel conferences. During the last one, I was kind of a late addition to the agenda. I didn't have any time to get my slides approved, so I did something really unusual. I just talked. And you know what? It's kind of freeing. It was kind of nice. And I thought, maybe I don't even need these slides. Always telling me what to say. So maybe what I'm going to do today is a little bit of a hybrid. I'm going to talk about the slides, but I'm also going to talk about some other things and just try to kind of keep it moving along. See when we get slides, everything worked out. But I'm just going to go ahead and start. Alaska Native and American Indians have the highest percentage of homes without running water and flush toilets of any group in the United States. I think a lot of people naturally think, well, that's a funding problem, but mostly it's not. Funding and lack of funding plays a role, but a lot of it is just the technology. The Indian Health Service and partners started doing this work in 1958. The heyday of installation of water services in tribal communities was around the mid-1970s. And the bulk of the systems that were easy to build and fit our technology were done during that period of time. Now, what you have left over, those systems that are either not served or served but struggling, is because they really don't fit the technology limitations of the infrastructure we're trying to use. We still have basically the same kind of water system that we've used for 100 years. It hasn't, the pipe water system and the treatment system hasn't changed all that much. So you have some unique challenges, and especially unique challenges within tribal communities. I was listening this morning, just as I see those unique challenges around Montana. I believe I heard Mr. Snow this morning talk about Fort Belknap. Fort Belknap, what is that? Maybe just a couple hours north of here. My geography is correct. Fort Belknap has some unique problems in that their water source is the Milk River for the community system. The Milk River is a lot like what you would expect from the name. It's milky, it's glacial silt, it's alluvial soil, and the water quality is generally poor. It has a lot of particles that you have to remove. But that's not the biggest problem, because as a water systems engineer, I can design a water systems treatment scheme to remove just about anything. You give me anything and I can fix it. What the systems aren't very good at is water that the source water rapidly changes. The Milk River changes rapidly and has these big swings in water quality. And it's hard to adjust for that. It's hard to accommodate it. So you still have troubles, and here we are decades later, still trying to get that system right. It was remodeled, I believe, last maybe 5 years ago, and hopefully it's working a little bit better, but it's been a continual struggle. Mr. Snow also mentioned the water wells and the individual wells and how they're shallow. The natural thought is where you just go deeper, but there's some other problems as you get deeper in the soil. So we're left with some challenges. Probably look at the slides for a while. So this presentation is going to deal with an overview of what CDC is doing to address tribal water and sanitation issues. Did you turn the slide for me, please? Okay. So this is important to state. The Indian Health Service Sanitation Facilities Construction Program and CDC's National Center for Environmental Health have a partnership agreement. It says we're going to work together to address tribal water and sanitation issues. Now this works pretty well because the Indian Health Service has a lot of people that know how to fix things and how to build water systems. They've got shovels in the dirt. What they don't have is a lot of science and research and disease surveillance, that kind of capacity like the CDC can bring. CDC doesn't have the things IHS can bring. So naturally this works pretty well. The next slide, please. So in this presentation, I'm going to briefly cover 5 activities or projects that CDC is working on to support tribes and tribal water. One of the important things to say is that Indian Health Service is a direct service provision agency. They have people that they serve and the things that they do every day. If they were to stop doing those things, the population would be harmed. They would be missed. They don't have a lot of time to do extra stuff that's important and that brings them closer to the goal over time, but it isn't considered those day-to-day activities. We do a lot of that kind of thing. So what I'm going to talk about today, I would consider mainly special projects. Next slide, please. The first project I'm going to talk about is one of the most important things that we do. The most important thing in this work. You know, there's a lot of money spent installing water and sanitation systems across the Indian country. And you can probably imagine there's a lot of critics. There's a lot of people who say we shouldn't be spending as much. Some of them are even in Congress or talking about the policymakers. We are under a lot of pressure to show the value of doing this work. Now, this work involves estimating the impact or the benefits of providing water and sanitation services in terms of avoided respiratory disease, skin infections, and infectious diarrhea. And we do that for every single project that the IHS funds. Now we also estimate the healthcare dollars that are going to be saved through prevention of those diseases throughout the lifespan of the infrastructure. And we've been doing this since 2015. Now, since 2020, what happens is in September, the Indian Health Service goes through and they have a scoring system. It's called the Sanitation Efficiency System. And they score out the projects and decide which ones will be funded that year. They forward that list to me, and I produce estimates showing by project the number of diseases prevented and the healthcare dollars saved in terms of the estimates. Those numbers go into the congressional justification along with the Indian Health Services request for funds. So what you can say is, IHS can say is, we're requesting X number of dollars. Here's going to be the benefit of those dollars. Next slide, please. This slide just shows the capital expenditures in terms of the number of total projects. Now, you can kind of see here, I'm going to point out the third column here, total expenditure. This is the money that Indian Health Service gets to build water sanitation infrastructure by year. So you can see it's generally gone up, but it's not really what you need. Also look at that per home. One of the things that I was thinking this morning, hearing Mr. Snow and his comments about the wells and drilling them so shallow, this is a challenge, and this per home number can run into a challenge for that. And what you get into is the cost of drilling a well is pretty much proportional to the depth that you go out. If you're going to drill a well that's twice as deep, it could cost twice as much. That's just kind of the nature of doing that work. And if you look at these per home numbers, it's not very much. You know, you could spend $200,000 drilling a single well, but you're only serving one family. And when you put that out here, this scoring system that Indian Health Service uses to decide which projects are funded and which ones aren't, one of the factors that heavily figures into that is called unit cost. So if you have a per home unit cost of 100,000, 80,000, or 200,000, a lot of times those projects don't rise to the top. So what project engineers for IHS and tribes do is they try to save money by maybe drilling into a shallow aquifer so that they can get funded. It's a little bit of a game, that it's not a nice game or something that you want to have to do, but this is what happens sometimes. Next slide, please. This just shows the, I want to point out the last column here, and this shows the return on investment. Now, I don't have the average there, but kind of what you can say, if you average this all out together, is if you spend $1 providing water and sanitation in Alaska Native American Indian communities, you save about $1.08 in avoided healthcare costs. So it's a positive. If we want to do more of it, right? You can also see that the numbers vary by year. There's a couple of big factors that fit into this. One is where it's being built. You know, you can imagine building stuff in, say, rural Alaska just costs more. So you have a lower return on investment. And then also the type of infrastructure that is being installed changes. Slide, please. I put this up here just to show kind of some local data. This hot off the press. This is the Billings IHS area numbers for this year. There's going to be 23 projects funded, serving about 2,760 homes. Not about, that's the actual number. And that's going to benefit 8,804 people. And you're expecting about 16,000 cases of disease that will be prevented, and at a cost savings of about $21 million. Pretty good. Next slide, please. I'm not going to go through this. This is just a couple of other examples. Okay, next project here. And I'm going to mention, I'm just going to briefly mention this. This is another cost estimation project because people are really interested in that these days. You know, why do you get rid of money? One thing that's important to understand, first of all, when I say O&M, that means operation and maintenance of the water systems. We just send around that from O&M. Now, operation and maintenance is important, but something that's critical to understand is the Indian Health Service, EPA, USDA Rural Development, all these federal agencies provide money to build the infrastructure, but they don't pay to operate it and maintain it once it's in place. This is a problem. And it's a recognized problem on both sides. So what happens? You know, something is built. Maybe it's not operated and maintained in the way that it could be, just because there's a lack of funds. And then later you have to rebuild it much sooner than you would want. So I had there is a new Indian Health Service director, Ms. So really been a good advocate for this area. And she asked me to give her some information. And she said, you know, what would be the cost savings in terms of reduced capital projects expenditures if we were to fund the operation and maintenance? You know, how can we estimate that? So with the next slide, I gave it a try. You know, I wanted to get an answer there. So what I did was I took a data set containing 390 sanitation projects that were funded during 2021. And I went through those and I looked at them and I evaluated. Now, our project description has a pretty good description of the reason that project is needed. And I went through and I placed each project into one of four categories. And the first category was those that were likely would not have been needed if excellent operation and maintenance had been provided. And the next one is projects that would partially be avoided if operation and maintenance were provided. The third column, not avoided, so no impact. And then there were some that I just didn't have enough information to make a determination. So those are the four. And with the next slide here, you can see this is kind of what I look. You know, when you're talking about that first category, those projects that would likely be avoided if you were providing operation and maintenance of the systems. About 24% of the data set fell into that category, and that represents about $62 billion. You probably save all of it. So that's substantial, and then you're going to save another $16 million during partial. And then there's others here, category 4, that you probably would fold back into some of those 1 and 2 categories if we actually knew why they were being built. So this is pretty good. And with the next slide, I said, hey, I'm happy you asked me to do this, but it's not a very good analysis. Just one guy, you know, doing a benchtop study here, and you need to make it better. And here's some things that we could do. First of all, you know, when you talk about initiating an operation and maintenance support program, what do you really mean by that? Like, what are the specific services that you want to provide? You need to define it. And also we need to expand the team. We need some more IHS people and some tribal folks to really look at this and make sure that I've done it correctly and how do we do it better. We need to formalize a code book and a process for resolving need differences in the coding. And then we need to apply these methods to different other funding cycles and years. And then later we can incorporate health outcomes into the savings. Because you're not just saving dollars. When the water system is operating correctly, You're getting better water quality, the consistent water that's been provided, and you're preventing dependencies. So those, it's important not to forget about that. Yes. I'm going to talk now about a category of infrastructure called transitional infrastructure. You know, you have a lot of homes in Indian country that are not served. And there is a temptation to say they need something. And that is a very obvious statement. You know, these homes that don't have running water, flush toilets, they need something. But there's also some reasons not to do that. And one of them is this scoring system that I mentioned, called the Sanitation Efficiency System of Indian Health Service, and other agencies also use this. When a home or a community has no service, they go to the top of the list. And so they're the next ones to get funded. But what if you go in there and you provide just something? It's not what they want. It's not what we all have, but it's something better than they have now. They still don't get the maximum number of points. They kind of go to the bottom or to the middle, and the other communities that have nothing, they go to the top. So there's a penalty for having what we call temporary infrastructure. There's also some restrictions as far as using federal funding to provide temporary facilities or temporary services. So there's been some problems with that. But now, because of the pandemic and the urgent need to get some level of service to homes that have nothing, we've developed what's a new class of infrastructure that we call transitional. And I was working in the Southwest for communities that had nothing during the pandemic, and we said, you know what? We're going to provide something here, and we're going to call it transitional infrastructure. Transitional infrastructure looks a lot like temporary, just standard name, but it satisfies everyone. With the Indian Health Service, it doesn't knock them below. It doesn't knock them to the bottom, because it's not temporary, it's transitional. They're just using it until they get something better. And the federal funding agencies didn't reject, because it's not temporary. What you call something matters. Who would have known this would work? But we've done a couple of demonstration projects, one in Alaska, one in the Southwest. I'm going to talk about those a little bit today. This is called the Mini-PASS, and Mini-PASS stands for Miniature Portable Alternative Sanitation System. And what you have there in that top cabinet is a 20-gallon water storage tank. And then you have a little hand sink in the bucket underneath it. This works a lot like the water system in an RV. You have a modern hand sink, but there's no pipe going into the home and there's nothing coming out. Not what you would want, right? Because if someone said, hey, we're going to come to your home and we're going to put this in, like, we probably would rather have this than what we have now. It's just not as good. But if you have nothing, it's better. So we've been providing these in, I think we put these in about almost 400 homes now in Alaska. There are villages that have no water, sewer, and it's working pretty well. We're also conducting an evaluation to see, how this is working, so that we can adjust it. We're looking in, could this be used outside of Alaska? I don't know. Typically, the reason that this system is used is because you don't have a good road system. If you had a robust road system, you could put a big water tank on a truck, and then you could have a bigger water storage tank inside the home. You need to have more water. And you could also have a sewage tank where the truck comes and pumps out the sewage. I don't know what the use outside of Alaska is, but in Alaska, there's about 3,500 homes that have no water sewer, and they can all use this, at least until they get something else. The next slide, please. This shows a home, kind of the before and after Mini-PASS. What they had before there, that 5-gallon bucket with the toilet lid and a little hand basin for washing hands. Now we've got the Mini-PASS on the right side. The next slide. You can also see this one problem we had. Some of these homes don't have bathrooms. So you have to be a little creative with where you put this stuff. That this home is better off now than it was. Please. We're going to talk now about transitional water points. Transitional water point is used. That's a place where a family without running water in the home can go, and they can fill up a container, bring that back to their home. Now, when you get to remote parts of the Southwest, sometimes you might have to drive for 50 or 100 miles to get to one of these water points. It's also difficult to install a new water point because there's a lot of bidding involved and a lot of requirements when you're going to drill a new well into the aquifer, and they're just difficult and expensive. But what we use here is what we call the transitional water point. Now, a transitional water point has a maximum flow rate of about 6 gallons per minute, but that's not very much. You know, if you wanted to fill up a big tank on a truck, you'd be there all day. You can come with a smaller container and you can get some water. It didn't require drilling new wells because we tied these into existing water lines, mostly in the chapter house. They didn't draw a large volume of water, so we could make that work. And then also, most importantly, we use local health data from the chapters to decide where to install these. So we were able to provide them to the communities with the highest rates of water-related disease. We installed 59 of these. Interestingly, we ordered 60. The 60th one is in the CDC museum, and so that's pretty cool. Next slide. I want to talk just quickly about Legionella. You know, Legionella is an old disease that's kind of reemerged, I guess I would say. Something that you didn't hear a lot about for a long time. And now it's coming back and it's getting more common. Now, Legionella grows in poorly maintained water systems. And over the last half decade, maybe decade, there's been a lot of new guidance and techniques developed to prevent this in large community water systems. Those techniques don't quite work in a small rural system. And there's also some unique advantages on tribal land that you can take advantage of by doing things just a little bit differently. So along with my partner, John Warren, who's an engineer at the Alaska Native Tribal Health Consortium, we drafted this document just that gives advice and on how to manage the risk of Legionella in small tribal water systems. We have this available now. It's just on up with this. It's going to be my last slide. I want to talk about this. I think this is really important. You know, there's some things in my career that just happen, you know, just works. There's also some things that don't happen as quickly as I want. But my old boss, Jeff Smith, said good ideas tend to hang around. And this is something I've been working on for about 5 years. I haven't quite got it to work yet, but I think somehow I will. Now, the Indian Health Service and also the tribal health system has 2 electronic data sets that have really progressed in the last 5 or 6 years. One of them is called the Sanitation Tracking and Reporting System, or STARS. This system has household level water and sanitation data. And it's very robust, and it's GIS. And you can bring this up, and I can look and see the quality of water in a home, in a native home by its address or its GIS location. And also, of course, the electronic health records or the electronic health information system. Those are both emerged. Now, what I want to do is to make this water sanitation data available through the electronic health record so that a provider that is trying to diagnose a person can use that information to help inform their diagnosis. I believe it was Ms. Vince who spoke just before lunch, and she told a really touching story about someone who had lost their life because their water-related disease was misdiagnosed. But what if a provider could pull up the health record and say, this person lives in a home with high arsenic, and yeah, it looks like they have some symptoms of diabetes or heart disease or some other this condition that might be affected by condition. That would be valuable. And going the other direction, to be able to pull health data in a responsible way to see the health impact of providing water and sanitation infrastructure. And if we're getting the value out of that, that would also be beneficial. This is a big effort, and there's many structural challenges. And if I just keep kicking it down the road and hoping that it'll work maybe before the time. But with that, I'm gonna sign off here. I don't know if we have time for questions or not. I have this picture. I usually say something at the end, like, now that you've heard the challenge, let's all pull together and fix the problem. But question.
Yeah, by clustered units within a tribal region, or what about the real homes way out in the rural areas of the tribes?
Are you talking about the electronic health record and the GIS system? That the quality of the data varies by area and location, but as a rule, all of the native homes are in there. And
You mean, my question is, on our reservation, we have housing clusters, but you also have stick-built homes on the land that are in the mountains. Does that include, how do you get the data from, if they're not part of a housing cluster, or do you understand what I mean?
well, yeah, I can say.
Because my family, my dad and mom built their home out in the Wolf Mountains in 1964. Stick built, paid for it on their own. And does that include your circle there of that information?
Yeah, it should. Now, a couple of things to remember. One, this system doesn't exist yet. So when you ask, I'm just saying this is something we're working on. We want it to work, but it's hard to answer that question because this is just an imaginary thing at this point. But when you look at the household level W star system, you know, if that family has reported the location, in most of the reservations, a water and sanitation person has physically gone to the home and collected the GIS location for that house and only into W stars. So you would think it would be there.
So you collaborate with the tribal government with their EPA program, their sanitation, etc.
Yeah.
That's a dream to do.
Well, as far as the W star system, how that data was collected by the individual tribe, no, I certainly didn't go around to all the homes and collect that data. What typically was is there was a request to the area level Indian Health Service. They pushed it out to the tribes, and then the tribes decided how that was going to get done in their area. Yes.
Any other questions? Really quick, if that's okay.
Yeah.
Do you think there's any way, and obviously it's not ready yet, it's not ready to go yet, but do you think there's any way that can piggyback off of the COVID wastewater surveillance data they've been using to maybe expand that into EHR and other general water sanitation stuff?
It's a good question. And of course, that's the big new thing right now in water and sanitation industry is it's wastewater surveillance. Those programs aren't expansive yet, you know, and there, of course, there's only a couple of tribes that are collecting, you know, wastewater surveillance data. That if you could somehow incorporate those, you know, if you look at the potential merger of these two data sets, you know, it's kind of like a code hanger. You know, once you figure out your methods, you can hang the individual codes on the hanger, and there's no reason that you couldn't add in household level water sanitation data, and that would be surveillance for the system.
Thank you, that was great. Those temporary water systems that you were showing, I'm sorry, transition water systems.
Yes.
You said you're just pilot testing those in Alaska. Do you think they could be useful for families whose wells have gone dry and have no running water in their homes, like in Montana on the Crow Reservation?
You know, if that home in Montana had access to a road, then I would put in a large truck haul system rather than the mini pass system, because they can get, you know, 600 or 800 gallons of water trucked in at one time and have a big sewage tank with a flush toilet as opposed to the miniature system. That's the way I would go if you had those conditions. The mini pass was used, you know, the unserved homes in Alaska also don't have a road. You know, there's not a robust road system there, or the road system isn't able to support a big truck that hauls water. So that's what I would use instead, and this is done quite a bit in the lower 48 reservations, as you have these truck haul systems that are just larger versions of the mini pass system. Does that help?
Come in and refill their cistern all the time. They need something really more affordable than that.
Then that would be a great solution and application. Yeah, you could put the mini pass in there. They're about $6,000 to build, and the family can fill them up and remove the waste on their own without additional expense.
Great, I'll talk to you more about it. Thank you.
Yes.
Good afternoon. Has CDC or any other federal governments have ever considered, instead of coming up with new ways to address our problems, but give us more resources, like such as funding to purchase well drilling trucks in our communities, and teaching our own tribal members how to maintain those well drilling trucks so that they can address the issues as they come forward. I know with my own tribe, we're currently considering that, and I know with those kind of vehicles and those trucks are quite expensive, as well as the drill bits and whatnot. And we're looking at, okay, once we do this, we've got to send people to go get educated as far as how to maintain these trucks, how to run them, and then working with our water resource program for well testing and whatnot. But, you know, we're looking at the idea simply because we're at the mercy of private businesses off the reservation who make a fortune off of us. We currently have a list of 24 houses that are built on our reservation, but they have no wells. And they're sitting idling. The mice are infesting those new homes because we can't move our families in them. So we're kicking around the idea of, you know, how do we address this issue? We have homes that are built, but we can't move families into them. And when we come to IHS tells us, well, you know, they're on the list, and whenever those private companies can get to them, they'll get to them. But instead of waiting around for somebody who tells us you're 18 months out on that list, and that house has already been sitting for 9 months, that's not feasible for these families. So instead of waiting for the federal government to do something, tribes are trying to address that issue on our own. But we don't seem to be getting any federal help as far as helping address that issue.
That's a great question, and I know that situation isn't unique. I've seen all around the country where homes have been built with the anticipation that once the home was constructed, a water pipe would be ran to it, and then for some reason or another it wasn't. And a lot of times we've been talking about homes constructed specifically by what we call the housing funds. The IHS funds can't use to hook those up, so it's not surprising to me what you're saying. Your core question though is, I think, a policy question rather than a one for a water engineer to tell you how to test the water. That this question of should the tribes be doing this versus IHS, it's a great question. Now I do know that many of the tribes, especially the ones in Alaska that I used to work for, are compacted. So essentially there's no IHS in Alaska anymore. We have a group of 3 or 4 people in Anchorage, what's called the residuals, maybe things that a federal person has to do, like signing certain checks and moving money around. But there's no IHS there anymore. There's only the tribes and the private organizations that they've created using the money that used to go to IHS. So that, I know it certainly, is an option. That's just my experience. Yes, question.
This is not really a question, but, there's, well, like one, where they did put houses and they design all this stuff and everything. I don't think there was too much good designs or plans. Because a lot of times where they put the houses, there's not even a good water source nearby. They put them where there's no electricity, they put them where there's no natural gas. They put them where there's high water table. They put them in an area that has no good access. I think a lot of it goes back to the planning portion. That you, rather than trying to solve it right there, like the spigot or that the water distribution line going into your house or something. Maybe they need to start looking at where the sources or the natural resources first. And that comes back to the tribes. I know they do a lot of houses and stuff, and they'll kind of get the designs from either BIA or IHS or HUD or something. A lot of these designs are the cookie cutter ones that could be built anywhere in that continental United States. A lot of those designs don't fit your area. I think if you're really gonna design something, they need to go back and look at the land use planning first. So to make sure that areas are designated for like housing areas. Where they know that there's possibly good resources there. While your utilities, a little corridor or something, utility corridors through there. Anyway, if you had more planning like that, there'd be a lot less issues in the long run. Like I know when people go out there to pick where they want to put their house, for my house, oh, I want it over there. Hell, they don't even know what's over there.
Yeah.
Oh, and in that corner over there.
A good example, what you're saying there, Crooked Creek, Alaska, most of the village is on the northern side of the Crooked Creek. But about 6 people went to the other side and they wanted to get away from the rest of the community. They built homes over there. You can't bring a pipe across that river. You have to have 2 separate water systems, and you can't build a water system for 6 homes. It's hard to envision how those will ever have water this year. And one of the things that, you're sort of talking about, we have 2 challenges. One, you have these government agencies that need to coordinate. And I don't know how long this has been going on, but you have the infrastructure task force that has representatives from the agencies like you're mentioning there. I think they should be talking about those and coordinating better. Obviously, it's not solving all our problems. And then you have residents that get to choose where they put their home. And sometimes they put it in places that we just can't build. At least we can't run a pipe. So that's a challenge. Yes.
Just jumping off of that, because of the Environmental Health Steering Committee and the testing that we did at homes, this is just a positive learning. My son was he got a 5-acre tribal site, home site. So from what I had experienced that I had with John Doyle and Maury, and I said, number one, find out how deep the aquifer is for your well, because it was way back. Secondly, find out what the closest electrical line is to attach where you're going to build your home. And so he went out and did his research and found out that it was gonna cost him $18,000 just to get the electrical line to his home site. And then he called his uncle, Lopez, he's, David Lopez, a geologist. And then he called the state of Montana for the geographical, to find the aquifer. That was about, I think, 600 feet down.
Yeah.
And so I said, you're welcome to build your home, think about it, but look at the cost. And then he had to get gravel, which would be about 2 miles. Pristine, beautiful place. But because of what I learned in testing the homes, and I shared that information, he said, always do your research. Always find out the aquifer, the electrical, everything that you brought up. And luckily, you know, if I didn't have that experience in seeing all of the homes that only had a 20 feet surface water and all of the junk that came out of there and the buildup in their bathrooms and in their sinks and the elders plugged coffee pots. I would have said, yeah, that's a beautiful place, just build it there, and the cost, I mean, it would have been the same scenario. Build a home and it wouldn't been, we couldn't get the resources, so that's a positive of what I learned about water and the environment. Just an FYI.
That's a great comment. You know, I think that, I hope this doesn't happen that often, but I've seen examples of it's kind of a game of chicken too, where you'll have someone say, we're gonna build a home there, so we can't put water there. And they go ahead and build it and say, you'll figure it out once it's there. No, we really meant it. We don't know how to solve that location or some technical problems. Sometimes it can get done, sometimes it can't, but it certainly, anyone who builds a home in a place where there's not a water service line and any good research to show that you can put one there is taking a good chance. Yes.
Housing, or the head of housing, they used to have classes where they teach people how to do planning and stuff. But then, it's just housing by themselves. None of those other entities come there to kind of guide them along, you know? It's just, we're not pulling together the ones that are really required for approval or to do their services there or anything. You're just getting a plan. And they had such a simple plan, it didn't even match our area, you know?
Yeah.
And like everybody says, each reservation is different, you know, and it's the truth, you know, and you got different geography, everything, you know, there's our, I guess, geographically, the ground and the water and everything, you know, it's totally different. Everything's pretty much totally different, so they have to design kind of for that area, and that's sort of cookie cutter designs come from the federal government and don't work out there. I don't know where you go with that or how you solve that situation, but you need to have people to come out and actually help them plan, not just, oh, put it over there at the bottom of that hill, you know. You know, and I know some people have done that and there's no way they can get utilities to their house.
Yeah.
But they got a real fancy storage unit down there at the bottom of the hill. All right, thanks.
Yeah, actually, it wasn't a question. It was just, I'm really happy to hear that you still plugging away at trying to get O&M funded because, yeah, one of the communities, of the tribe, we've been having meetings over there, that had to do with the environmental justice grant, and the community goes on for hours at a time talking about their water. And, you know, a new treatment plant was just put in, but the tribe is lacking on trying to get someone to operate and maintain. So,
Yeah, operation and maintenance is our biggest challenge. And a lot of communities that aren't served currently, they're not served because there's no sense that that a system could be maintained when they're. So operation and maintenance, the Indian Health Service has always been authorized to provide operation and maintenance support and funding, but the Congress has never allocated funds specifically for that. But there is strong consideration now. And because, you know, every, you know, with the new infrastructure bill, technically every Alaska Native American Indian home has been funded. But the question is, if you were to build all this infrastructure, how is it going to be maintained and operated? And that's the next phase. Thank you.